Hello, this is the fifth lesson of our course in transpersonal psychiatry, and we're going to finish with some authors of this field, and also we'll talk a little bit about um, non-ordinary states of consciousness induced by substances. So let's start. So we will talk a little bit about Dr. Assagioli, Roberto, because he's one with Jung and a few others who already had started a new approach to psychiatry. We are about in the 20s, 30s here, and he also knew Jung, but he was mm, constructing a new system of his own, which is called psychosynthesis. And since he was a psychiatrist, he also left some uh, things written about how psychotic crises could be interpreted as a change in consciousness and which were somehow difficult, impeded, but also always had to be seen as an endogenous process of a spiritual kind, and that there were some phases in this process which I also can find in other authors, which accompany the emergency process, the emergency of different states of consciousness. So he was talking about five phases, in which there was one phase which is sort of a precursor, a sort of an antecedent to real awakening, which would correspond in our previous videos to an activation of Kundalini, not really an ascending of Kundalini. And in this phase already there is an identity crisis and there is a movements in energy. How do we see that? Because identity crisis comes from being unsatisfied, feeling impotent, feeling there's no meaning in life, and so on. But also the energetic aspects are a sense of agitation, of sleeplessness, of being feeling unrestlessness, and so there's also a difficulty inside, a sense of lack of meaning in life. So people want also think that they should maybe suicide. This is the first phase. But then when it grows up, you feel a sort of amplitude from the awakening process. So you're really confused about which is the real reality. Is this the ego reality, which we knew until now, or is the new one? And so all this energy, which is really exuberant in this phase, you can have activation of the chakras, sort of paranormal also perceptions, because you have activation of all the chakras, physical symptoms like heart and breath symptoms, and a sense of beauty, a sense of expansion in the more positive phase of joy, and also of uh, being in a labor and feeling all the inferior tendencies to wake up and to be judging without judging oneself, judging the process. So there's a cyclical, rhythmic interchange between the two levels of consciousness, and the person is trying to integrate them. When he does that, then we're in another phase, which is integration of all this process, like the process of a worm becoming a butterfly. And so all the difficulties come to be understood. And there is a sort of effort also to help this process by, for example, meditation or changing one's life. And not only being irritated, but also to understand some of these difficulties which are also created by ourselves. We change our role towards family, towards work. There's this integration process. And then the last process is in the deeper of the night, which is called the black night of the soul, the obscure night of the soul, in which there is really a loss of all previous points of fixation. It's a sort of mystical death. It can be seen as depression if one is not prepared as something which should not be there, but actually it is there for a reason. You have to be impotent in your will because some bigger will is coming. You're not acting personally because some bigger action is coming. And so all this intensity is in a sort of a negative way, but it can be stood, it can be withheld, it can be upheld if one is understanding what the process is about. So this is also the role of the teacher, of the guide, of the therapist, because he's going to, in the different phases, indicate different things which should be addressed, like, for example, understanding what the process is, or helping the transmutation process in himself because he himself has passed through that, or also other indications of therapy, for example, helping the superior aspects to manifest. you can differentiate what a psychotic situation is in a person who is unprepared from a spiritual emergency by observing how the inferior aspects are being dealt with by higher consciousness, in which it is easier to see the way out in the more advanced people. In a more harmonic way, the symptoms develop in a person who is prepared. So I think Assagioli is not making really this difference that there are psychosis on one side and then there are the spiritual emergencies on the other side. He's a sort of a guy who really is seeing how one thing can lead to the other and how to help. He also says that the help should be of a threefold kind. For example, we should help not only the patient, because we are already prepared personally to that, so the therapist should have undergone this kind of transformation, but also the people who assist the patient, that is, the family, the nurses, and so on, should be prepared and should be educated on what is happening and how to deal with it. And also, the general population should be informed that a different way of seeing mental illnesses could be accepted. So, this threefold preparation is essential to help the person to come back to himself, to the union with his divine reality. This is for Assagioli, which should have been mentioned. Another person who's really important in all the development of transpersonal psychology in the States, particularly, is Ken Wilber, who wrote extensively since the 60s and has helped the people to come to understand that there is a connection between the science of psychology and the perennial philosophy, and that is the consciousness spiritual side of of this. And as we have already written and said, he has developed from Graves this model of integral spiritual development, in which the superior levels of consciousness take care of the previous ones. So they're all nested one into the other in the big nest of the being. And we don't have only an horizontal development from more ignorant to more knowledgeable in the, for example, cognitive aspects, but also in the emotional aspects, in the musical aspects. All the kind of intelligence can develop on an horizontal level, but they can also heighten in a vertical level because of awakening. So one thing is to be very knowledgeable and not awakened, and one thing is to be very knowledgeable and awakened. So the AQUAL, all qualities, all quadrants, all levels, gives a sort of integral aspects of psychology, which was lacking until then, but they really open up to a world in which spirituality is included. From this point of view, also the third person we're talking about today, which is Stanislav Grof, a psychiatrist which is coming from Budapest, Hungary, and which has, in those years before LSD being banned, experimented with this substance in psychosis. He had a clinic in which he would treat these people, and when the ban came, he sort of developed a new way to access non-ordinary states of consciousness through holotropic breath work, which is sort of pranayama, change a different pranayama, in which anyway things emerge, and the psychotherapist should be able to accept and to integrate these. So we see already in this that there is an attention to integration and to set and setting. That is what is the mental and personal in the interior intentional approach of the person who is undergoing the process, the set, the mental set, and the setting, that is in what kind of situation with a psychotherapist in a quiet place, in an understanding and evoluted milieu is this process happening. That makes all the difference between using it in a therapeutic way or in a recreational way. We want to mention the fact that Grof was also important not only for developing this transpersonal aspect of mental illnesses and personal evolution, but also in giving an opening to what happens during the birth of a child. There are four moments in the birth of a child. One is when he is still into the womb and he is quiet or he is discomfortable, but this is a situation which has not yet come to a strong push towards birth. And in a second moment, there is this activation of birth. And so the cervix is still closed, but the pressure is really great. And so the child is suffering a sort of suffocation, and he doesn't see any way out. He doesn't see any hope. And in the next stage, we see that there is this opening, and so the child is fighting for birth and before he has to sort of die to the previous situation. And in the fourth phase, when he really comes out from the mother, it's like for the phoenix to be sort of reborn, to come to the light. So these four matrices of the perinatal experience do activate and repropose in the adult phase of a psychotic crisis in which identity is crushing, and so it is a sort of rebirth, and we relive these situations on the basis of how they have been really dealt with in the first place when the child was born. So the opening of the cartography of the evolution of psyche to the perinatal phase is really a new thing coming from Grof, and which he explains in his writings, like the new psychology, or like psychology of the future. So we have seen until now that psychotherapy and psychology has changed a lot from humanistic to transpersonal, first also in Europe through figures like Jung and Assagioli, but then in the States with the work of these pioneers, which were Ken Wilber and Grof and many others. And we are now coming to the fact that this theoretical aspect has been sort of explained, and we want to pass to a second phase of this video, starting from the fact that Grof exactly was the one who mostly experimented with psychedelic substances to treat mental illnesses. So he was thinking that not only non-ordinary states of consciousness were coming from spontaneous activations of consciousness and kundalini, and that's what we see in psychiatry because people are not prepared to see this, or if they are prepared, we see spiritual emergencies, but also that these non-ordinary states of consciousness from immemorial times have been activated with certain specific sacred substances which are very potent, but should also have been should be dealt with a respectful attitude because in a sacred environment. And so he was using LSD particularly, but there's a lot of other substances which can induce non-ordinary states of consciousness. So uh, we have these three situations: uh, non-ordinary states of consciousness activating spontaneously in clinical practice of psychiatry and in spirituality. We have techniques of the sacred in which, through meditation, respiration, mantras, ritual dances, sexual practices, rhythmic music, and so on, and psychotherapy, we can activate in a particular milieu, in a particular setting, these non-ordinary states of consciousness, helping spontaneous ones or activating them. And the third situation in which these states were activated by particular psychotropic substances, and these can also be used in the previous phases. So we see psychiatric patients using substances, we see also meditation and sacred practices using substances, which is, for example, the case of ayahuasca, a particular substance containing dimethyltryptamine, DMT, and which are sacred rituals from the Amazon, and also we see the indigenous Indians in America who were using peyote or also ayahuasca to start initiation practices, changing phases of life. And so rituals and substances were used together to help and to activate these states. So we should not put drugs all together like the ban of this has been it has been done through the um, recent 1970 Controlled Substances Act in the States to repress and to ban not only drugs but also liberation processes which were against, for example, Vietnam War or against the conditioning in society. There was a sort of a liberation process which was helped by these drugs, and so the power reacted through the CSA. Before that moment, these substances, which had already been discovered in the 30s and the 40s, differently in natural substances, but also synthetically constructed substances coming from these plants, for example, or also synthesized in the laboratory, like it happened for LSD. So before that 1970, there was at least 20 years in which psychiatrists and people were so much interested in recognizing the power of these substances and experimenting in mental illnesses. It was also the phase in which there was this psychopharmacology birth and evolution, and so they were going sort of in parallel. But once the act, the CSA Act, was put up, there was no possibility to continue research into this. We can only access to all those very numerous articles who were produced in that period. But after that, there was a sort of silence, and until the 90s or the 2000, before this so-called psychedelic renaissance, there was no much research. Only a few people started again to come up with research in the 90s. For example, we can see that this happened with, for example, psilocybin and LSD. Psilocybin comes from these mushrooms called psilocybe, which contain psilocybin, and who now are being used in some situations for obsessive compulsive disorders, for as antidepressants against depressions, dependency, excuse me, in situations in which people are in the end of life, for example, being with the terminal cancer, disturbances of personality. There's a lot of these applications that could be thought of and could be experimented better with. This also happened with mescaline from peyote, and we remember that from the book of Huxley, The Doors of Perception, there was a big interest on these entheogenous substances. DMT particularly is present in a lot of situations. It also is probably present in the pineal gland naturally. And so, for example, this Dr. Strassman, who wrote a book, DMT, the spirit molecule, also a film was made from this book, a documentary film, which you can find on YouTube in 2010. And this Dr. Strassman experimented already in the 90s how we could again use these substances to help people come out of their difficult situation. So there's a lot of material in this aspect, beginning with the history of all these substances. Hoffman is a particular important guy in this because he synthesized LSD, but also extracted psilocybin from the mushrooms. In the beginning, the Sandoz company for which he was working in Switzerland produced these substances and sent them also to psychiatrists and asked them to try in themselves to understand better their patients and to try with the patients, so on. All that story ended up in 1970. So we have now to see how uh, it has also been used by CIA, by the power to try to control mind. So there was a big interest for all these substances, which came up to a halt in the last part of the last century. What else can we say? That these substances are also present in other plants like Salvia divinorum. You can also find this DMT in the salivary, or not salivary, in some glands which are present in a sort of toad, which lives in Mexico. Ketamine is a substance which we use normally for anesthesia, but used in certain in certain dosages, which is different from anesthesia, a lower dose, of course, and also used in a certain setting, which is well to provide, can help because it is also dissociative. So we have to help really the person to be protected, but it can really help to deal with some psychiatric problems like depression and PTSD, anxiety, and um, mood disorders. These substances have been already experimented partly, and we can find literature on this. MDMA is another synthetic substance. It is the essential component of those pills who were called ecstasy or Molly, and they have a particular inclination. This kind of molecule has an inclination for an augmentation of empathy and of social reconnection. That's why it is also called an empathogenic drug, and it is really an interesting drug to use together with psychotherapy to make things emerge and also to deal with them in a different frame of mind, in different consciousness level. All these substances, or at least some of them, for example, psilocybin and probably also MDMA, they help also a reconnection of certain connections in the brain, which with growth and education sort of become more dim, they fade out. And so the brain is as if we were using more potential. That's what also they were saying in the hippie revolution, that we use that our brain is really filtering reality. We see reality in a sort of more dim way, and with these substances, this filter is sort of freed out, and we can have access to a greater potential in ourselves and in society. Cannabis is also a long story. There's a long war against cannabis, but that's also because it was used also for fibers in textile industry and for paper construction. So there was a war also because other substances were to take away, like for example, synthetic tissues. And so the legislation went after this trend, and it was demonized. And even now, in particular in Italy, even the last law on conducting cars, if you have just have in the last week even smoked one weed, you would be in a great difficulty because you could not drive anymore and so on. So there's really a sort of war and a demonization of these substances, which can be very useful in therapy if used in the right way. For example, cannabis is very useful also, for example, for Parkinson disease. It is also used as a therapeutic agent in depression, sometimes in anxiety and depression. People sometimes really also smoke because they find it is a sort of auto therapy. Other substances, on the other way, which do create dependency differently than DMT and so on, but like alcohol, like tobacco, like heroin, have been only recently banned. For example, tobacco and alcohol are not banned at all. There was they tried to do in the prohibitionist period a sort of stop to alcohol, but it just incremented the criminal organizations which were offering the alcohol anyway in a secondary way. And so from this also there is a big danger in the new drugs, for example, fentanyl, which is so widespread now in the States, but not only there. And we can see from this graphic in the lower part left how deaths by accident, by suicide, by overdose have incremented very, very much because of these new kind of drugs, which are very addictive and very toxic. And we should not make this just one bunch, one thing together with psilocybin or DMT or what LSD, because those can have a really, on the contrary, a positive effect on growth and health. Okay, I think we should stop now here without talking too much also about the rest. Also, cocaine is a big thing to talk about, but we'll stop here for the moment, and we will start next time with the first video on the practical side of all this, that is about clinics.